more pretty good people we have that run, the chances of the really bad ones getting in, I think, are lower. So that was my plea to you guys. Please go out and vote. Don't let these puppets win here. Okay, it's 9:06. Let's go behind bars now, where definitely they have some news that we want to hear about. Major Antone Aguon. Good morning, Major.
Good morning. Good morning.
Good morning. Good morning.
So two DOC officers. I know that one of them was a female corrections officer working in the female unit over at DOC. What about the other officer?
There was only one correction officer that, as of last week, tested positive for COVID-19.
So there's not two?
No, just one of our correction officers.
Oh, okay, so did an inmate or a pretrial detainee?
No.
No one
Not
else.
that I'm aware of. No.
Just one. Okay.
Yes.
And so where are we then with testing employees? Is that part of the plan, or testing any of the women in the unit or any of the inmates, no matter where they are at DOC?
Right now, what's going on is the public health is conducting their contact tracing. And so a lot of it will determine what's the result of their investigation on who would need to be tested. As of now, they just gave us a list of about 5 officers they need to see as a result of their contact tracing. But again, it's just preliminary. They just started. So will there be more officers? I don't know. If they need to see them or possibly test them, I don't know. It's just going to depend on what's the result of their investigation.
So just officers at this point, no inmates or detainees?
At this point, no. Again, as part of their investigation, if they determine that, possibly an inmate may have had, close contact, which may result in the transmission of COVID, then I'm pretty sure they would probably test that inmate. But as of now, where they're just looking at officers, and again, the investigation is just preliminary, so it just depends on which way their investigation goes.
Major, is there any connection with the DOC officer positive and the positive over at the Guam Police Department?
Not that I'm aware of. I haven't. I've seen the one at GPD, but I cannot confirm and say if anything was related, because I don't know who at the GPD is positive.
Okay. All right. What about the women that are in the unit that were connected to the female officer? Have you had to move any of the inmates around or anything like that?
No.
Okay, so they're all in.
Yeah, they're all still there, and we did talk to the medical team this morning, and as of this morning, 8 o'clock, there have been no complaints or any issues from any of the prisoners.
Mm-hmm. Okay. Had this particular female officer, she worked or in any other units or signed to any other units other than the female correctional side?
Based on our report, yes, she's worked at the clinic, the infirmary. She was assigned there for a few hours, and then she was reassigned down to the female unit. She also worked in our RSAT building, and then she was again reassigned back down to the female. Most of her time is spent in the female unit.
So the 5 officers that were identified as close contact with this particular female officer, were they assigned to other units, any of the units that you just referred to, or are they just within the female unit?
Most of them were, out of the 5, 4 of them are female officers that were working with the officer that tested positive. The other one is a male officer that was around her while she worked at the clinic.
Okay, so what about
our clinic here at inside the prison?
Mm-hmm. So what about the people that are the inmates that are in the clinic or anybody else inside the clinic? How have you guys done checks on them? Or are they not considered high risk exposure?
Well, the clinic is mostly with nurses. And so with the nurses, I believe with the GMH side, those nurses were tested as part of their protocol on GMH side.
And what were are you aware of the results?
No, ma'am, I'm not. I think that the test just happened Friday or so. So I don't know what the results are.
Oh, but they would let you guys know because they were in your facility, right?
Yes.
Okay.
Yes.
Okay. So what is if we could go over the plans for when a situation like this happens, what does the Department of Corrections do? We just kind of wait for public health to tell you guys, this is what you need to do?
I mean, most of it with the staff, yes. An officer reports that, and we have our protocols. We contact public health. We work with them on the contact tracing to help determine who needs to be screened or who should be isolated. I mean, the first time this thing happened, we automatically, with the recruits, put all the recruits on administrative leave, self-quarantine, but we can't do that with all the other officers. I mean, just the absence of the 5 officers, it can impact our operations here. So, again, we do tell our officers if they are feeling any symptoms or sick, whether it's this COVID-19 symptoms or if they're just sick and they don't feel well, to go ahead and stay home and seek medical, go to the doctor and get medical checkup.
For the female unit, how many officers are assigned to the female unit, and do they have to be female? It's just because I'm wondering. You said there were 5, 4 of which were identified for testing. So they're on what, quarantine, right?
Yes.
Until they're tested.
The only female officers are assigned to the female unit.
Do you have enough female officers then to work this female unit while the 4 are they on quarantine?
Well, right now they're still meeting with public health. The other 5 officers, they will be meeting with public health later this morning. The person in charge of the contact tracing will be meeting with each of them, and whatever his protocol in regards to investigating this. But we do have other females. We may have to reassign some from other sections, like transport and other areas, to cover down.
Yeah.
But it's nothing that we have not done before, as far as reassigning personnel.
Right. I just didn't know if you had enough female officers, because I believe you said 4 of the officers that were identified were for testing or as close contacts were women assigned to the women's
we
unit.
have enough female officers. We just have to reassign them from other sections.
Right.
But some of them may be in our transport section, our visitation section, and other sections within the department. We just have to reassign if need be.
Major, it kind of sounds like you guys have a better handle on public health in terms of where this a positive officer was working, who she was in contact with. That being said, have you guys, while public health is doing their contact tracing, have you guys on your part done any measures to kind of compartmentalize, if you could, anybody who's coming in contact with her?
Well, yes. I mean, because we still have our own protocols in place as far as the mask wearing and so we still have all these other precautions that we implemented months ago that we've been doing to prevent this. I mean, we kind of anticipated that something like this might happen eventually, and that's why our director are always stressing on the wearing of the mask, because even if you do come in contact with someone with COVID, if you're wearing your mask and protecting yourself, the chances of you catching it is slim. So,
just curious, DOC, do they get the differential pay?
Yes, we do.
Okay.
We get the extra pay.
Major, are you planning on resigning or retiring anytime soon?
No, I just hit my 26 years tomorrow.
Wow.
Tomorrow's my 26 years with DOC. So, no, not yet. Got a few.
God, 26 years at DOC, that's like 56 years in any other agency.
Yeah, so, no, not yet. Still going to be around.
How about Director Carbolito or Deputy Director Camacho? Are they planning on resigning or retiring?
Wait, Camacho. Is Camacho there?
Robert Camacho, yes.
Oh, he's still there? Did
Right.
he retire? Or?
He retired from the airport police.
Okay.
He is here now, and No, I don't think any of them are planning on retiring or leaving soon.
We just got to ask because there's something else going around that is more contagious than COVID.
Oh boy.
Yeah,
He's
it's
just
quit
joking.
vid. It's quit vid.
No, we're still
Rovid.
hanging in there.
Huh?
The other thing too, I would want to let you know, Chris, that because of this, we were scheduled to have incoming for the inmates. I think by next week or so. But right
Right.
now, the director has suspended everything again until such time the public health is done with their contact tracing. So we're not going to have any incoming or anything like that we were originally going to have. And again, we just go back to square one for
Right.
now until public health has, figured out who may have contacted it.
Major, what is the public health contact trace investigation? How many people are investigating this? Who are you in touch with? Because you remember, one of the key parts is having a robust contact trace investigation team. And right now they're investigating 15 positives all over the island, or 16. They're doing the airmen probably. They're doing a contact trace investigation at the prison. So what type of numbers are you seeing from public health investigating this? Because we're just trying to find out by going all around if they're short or if it's an adequate team.
Well, I don't know what team they have in place. I do have a contact. They contacted me over the weekend, the one person that I'm dealing with. So I'm just going through this one person. Now, if he has a team on his side, I'm not aware of it. I don't know what team he has in place. To prevent any kind of mix-up of information, I'm just dealing with one person right now. And so, I just refer my officers to this guy and this gentleman, and he will take care of the rest, and he lets me know if he needs something else, and then I just get what he needs or who he needs.
Yeah. Okay.
Yeah.
What about contraband update? Contraband, inmates smoking ice. Where are we with that?
Well, we haven't really had much contraband over the weekend or the last week, so not to say that we won't have any this week, but pretty slow week last week.
Is there any talks at all about the possibility of getting all the officers tested or all of the inmates, detainees tested?
That has been brought up numerous times, and again, with the inmates, a lot of it probably has to do with maybe the resources, because we have 630 some inmates.
Mm-hmm.
In addition, again, you would need to test all the officers too. So, working on a plan for that, that would be pretty intensive. As far as how do you test inmates and officers simultaneously, and then we would look at isolating, because I believe when you test them, you have to separate them from the ones that are not being tested, and so again, it's not impossible, but it is a pretty big undertaking.
Wow.
So right now, again, we just take our guidance from public health as far as who needs to be tested.
And so basically, you guys are not testing all of the officers because there's a concern that you can end up with a bunch of positives, and then who's going to watch the prison?
Well, even if they're negative, Chris, I believe when you test them, they have to be isolated for so many hours until
Wow.
the test, or a day or two. So if I have 200 officers and I decide to test all of them, who runs the prison?
Right. But on the flip side of that, Major, if you don't test them, they could all be COVID positive, and we don't know, and they spread it.
I mean, both ways. It's
Right.
it's not a perfect situation, I guess.
How about you? Have you been tested?
No, I'm not feeling any signs or symptoms, and there's no need for me to be tested right now. But I maintain my mask and do what I'm required to do to try to protect myself. It doesn't mean I won't catch it in the future, but
Of course.
I do what I can to protect myself and my family. But right now there's no need for me to get a test.
Okay. I think we're good. Anything else you want to add, Major? Are we missing anything?
No, not that no, pretty much.
They always say
much
that. I never had one government of Guam person say, "Yeah, you're actually missing the thing, the real controversial thing you didn't ask me about." He's like, "Nope, yep, we're good. I gotta go."
We're good. We're good. Yeah.
You know, I did want to go back to the first DOC officer. Was there any finality in determining where that officer may have contracted COVID? Was it?
No, my understanding when it first happened was it was from a family member.
Okay.
Right?
Okay.
Yeah, it was a
He
young.
got it from a family member,
Right.
but
Yeah.
And so
since
what-
then he has returned back to work and no other issues.
What about the current one? You guys, it's too early to tell whether or not.
Too early. We don't know.
Have there been any new women that have been brought into that particular unit where she's assigned?
I you know what? We don't get a lot of women every day, but 'cause right now the population there, I believe, is about 20. I don't know if maybe one or two new consignees came in since last week, but I'm not really sure. I don't have the numbers in front of me as far as the daily confinement.
Okay. Yeah, it just would be interesting to see if there have been any new inmates or detainees. Is it just all pretrial detainees or just inmates in that unit?
No, we only have one female unit, so this female unit does have inmates and
Pretrial detainees, so okay, so it's a mix. All right.
Yeah. One of the things we're hoping, is because of our procedures in regards to the wearing of the mask and stuff, that, even if our officer did have it or a prisoner had it, new confinee, that the risk of being spread to the other staff or other will be minimized, because even the inmates they do have masks. So the inmates have masks and officers have masks. So, that's one of our preventive measures, that
Right.
in the event someone does have it, it may not be spread as easily if that officer or that inmate is wearing a mask.
But the inmates don't wear masks. They do?
All the inmates do have masks.
Right.
Okay.
Was that from the director, Major?
We gave that out, we gave them out several weeks ago.
I remember, yeah.
Yeah, we've been giving out masks to the inmates.
But I remember you said that the director had a bottom. Was that just with his personal, or is this department funds?
Department funds? Yes.
Yeah. Okay.
Are these disposable masks or are they reusable?
Most of them are disposable.
And so, how often are the inmates and detainees given a new mask?
I have to speak to my supply on how. I mean, I know each unit has masks, and if the inmate needs one or needs to replace it, they can go to the officer and they can
see.
replace it.
Okay.
I don't think they're given a new one every day or every week. It's just once it's been issued, if they need a new one, then they can get a new one.
So one and done unless they need a new one.
Yeah.
All right. But again, there's no movement to test all the women in that particular unit because of the fact that you're mixing pretrial detainees
Right.
in the in that unit, which means that
They're leaving the prison.
Right.
Yeah. Not at this time, but again, if public health determines on their contact tracing they need to, or any of the females start to show symptoms of COVID-19, then of course that will dictate how the medical staff respond.
Yeah. Okay. Well, yeah,
Okay.
it'd be interesting to see the SIT report today to see if this female officer had any connection to a confirmed case, and if not,
I mean, the officers do, of course, we interact with inmates, but most time the officers are not like in direct,
They're not
standing
French
right
kissing
at
the
right
inmates,
at
or
the inmate's
right?
face.
Yeah.
They're not necessarily standing right at the inmate's face.
Right.
I mean, most inmates, if you're just in your cell or in your area, you'll see an officer, but it's not like you may or may not come in direct contact with
Right.
that officer.
Right.
They don't go up to the face of every inmate and see them, and our officers too are practicing. They don't need to get up in front of the inmate. They can give instructions from a distance when they give instructions on doing things.
Right.
Okay, Major.
Thanks, Antone.
Okay.
Be safe.
Okay, you too.
Keep us posted. If you can, shoot us a message about any developments.
Okay, I will just have to wait for public health to give us
Right on.
what they discovered.
I'll call
Okay.
Linda too. Oh wait.
Okay.
No, I won't. Yeah.
Very well.
I can't call Linda. Okay, Major. Thank you.